A 45-year-old man presents to his internist with worsening fatigue and myalgias over the past several months. He describes his thinking as clouded and states that he is unable to focus or think clearly anymore. He lives alone in a downtown apartment building and works in a local shipyard. On physical examination, he appears pale and fatigued. A peripheral blood smear reveals microcytic hypochromic red blood cells with basophilic stippling. Which of the following is most likely elevated in this patient? Go ahead and pause the video and try the question yourself before we go to the solution. So here we have the pathway for heme synthesis, and note that heme begins with glycine and succinyl-CoA and ends in the synthesis of heme. Specifically, we should pay attention to lead poisoning, which is inhibiting the conversion of ALA to porphobilinogen, or the conversion of protoporphyrin IX into heme. There are two diseases which cause lead poisoning, and while I'm not going to go over this whole pathway with you guys, note that a deficiency or exposure to lead would cause an elevation of either ALA and the molecules before ALA, or protoporphyrin IX and the molecules above protoporphyrin IX. So now that we understand how lead poisoning affects the body, let's go to the question choice. Let's go back to the question. A 45-year-old man going to the physician with worsening fatigue and pain over several months. Additionally, he has neurologic defects and works in a local shipyard. So things like shipyards, batteries, factories, lead paint, and children should help you think of lead poisoning as a possible differential. His pale and fatigued appearance is consistent with anemia, and he has a peripheral blood smear which shows microcytic hypochromic red blood cells with basophilic stippling. So patients who have a microcytic anemia can be narrowed down to the mnemonic tails. So here we have thalassemias, anemia of chronic disease, isoniazid, L for lead poisoning, and then S for sideroblast. So this patient likely doesn't have a thalassemia because that would present earlier in life. Chronic disease, we can keep that on there. Isoniazid, so there's no evidence that this patient is being treated for tuberculosis, so we can safely cross out isoniazid. Lead poisoning, definitely pretty high on the differential. In sideroblastic anemia, that's unlikely, as sideroblastic anemia would have likely presented earlier in life. So that leaves us with anemia of chronic disease and lead poisoning is directly supported by the passage, whereas evidence of a chronic disease is not. Additionally, the presence of basophilic stippling is characteristic of lead poisoning. And the reason why is because since heme is unable to be produced, then you don't get the iron in the center of the heme group, and that iron just kind of builds up in the mitochondria of the red blood cell, which stains blue. Additionally, the hypochromic part of the anemia is suggestive that there is not enough hemoglobin, which is giving the red blood cell its hue. We should remember that lead can either inhibit ALA dehydrogenase, which converts ALA into porphobilinogen, or it can inhibit the conversion of protoporphyrin IX into heme. So the answer has to either be ALA or protoporphyrin. Since ALA is the only answer, A is correct. B is incorrect because if anything, glycine would be elevated because glycine is upstream of any of the enzymes which could possibly be inhibited. Porphobilinogen No, that would be decreased because lead inhibits the conversion of ALA to porphobilinogen. Succinyl-CoA, no, because succinyl-CoA is upstream of any of the enzymes that are going to be causing that are going to be inhibited by lead poisoning, and uroporphyrinogen 3 is not going to be correct because that would be another disease such as that would be a different disease in the synthesis of heme, such as Porphyria cutanea tarda. So now that we understand that, that's it for this video.